are back with Dr. John Kressel, radiation oncologist with Phoenix Cyberknife, and he's brought along his patient, Mr. Kenneth Krieger. Great to see both of you. I want to start with you, Kenneth. What was your cancer diagnosis?
Well, I actually had two cancer diagnoses. One occurred in 1992, and it was a diagnosis that said I had an 11.5 centimeter tumor in my right kidney. 20 years later, I had a diagnosis that said I had a smaller tumor in my remaining left kidney.
So your right kidney, the first cancer diagnosis, what happened? What did you decide to do? What was your treatment option?
Well, the state of technology in 1992 was that chemotherapy didn't work, radiation therapy didn't work, and the third option was surgery. So I had the tumor removed surgically.
And you now only have one kidney.
One kidney.
So now
yes.
your good kidney, the only one you have left, now you get a cancer diagnosis there. What was your option this time around?
Well, the options were, again, surgery. And in addition, though, there was now an option to use radiation.
Okay, and you asked the doctor, hey, what's going to happen after the surgery? What are my chances of having a good functioning kidney? What did he tell you?
Well, I went to one of the, I guess I would say, premier facilities in the valley, and the urologist said he was going to do a very large incision, and he would move everything out of the way, and he would go in and open up the kidney and then take the tumor out. And if he had too much trouble doing that, he would take the whole kidney out, bring it to a workbench, and remove the tumor that way, and then put the kidney back in again.
That sounds disturbing.
And I said, what are the chances that the kidney will be functioning when you do all this? And he shrugged his shoulders and said, 50-50.
All right, so then you decided, okay, that wasn't a good answer. So you decided to see Dr. Kressel. And tell me about your experience at Phoenix Cyberknife.
Well, the experience basically was all good. And it was just an amazing advancement between 1992 and 2012. And in 1992, I went through a lot of pain. I went through a lot of trauma. I mean, your system is opened up, and it takes a long time to get back to normal. I felt it was about 1.5 years. When I went to see Dr. Kressel, the procedure was I walked into the radiation room. The technician suggested I might want to take off my shoes. I laid on a platform, and for 50 minutes I listened to Anya music.
Oh, wow. And you drove yourself there?
I drove myself there and drove home and went about my business for the rest of the day.
Dr. Kressel, what is your reaction when you hear patients tell you, and this is a good patient because he's had both, surgery and then Cyberknife. What do you think when you hear this?
Well, it's the same message that we're always trying to, have patients understand is know all of your options before you make a decision. In this case, the other physicians weren't trained in Cyberknife radiosurgery, didn't know really what the outcomes could be, and didn't, offer the patient that option. So, we want to make sure that we can share that with patients so they can decide.
And what did you do for him very quickly?
So, in this case, for Mr. Krieger, we treated the tumor that was in his one remaining kidney. 5 treatments, 5 days in a row. Each day was about an hour, done as an outpatient. And I don't think there was a lot of recovery time, no anesthesia, nothing like that. He went golfing after his last treatment.
I was about to say, didn't you go golfing?
Yep.
Wow, you feel good today?
Very, very good.
And
yes,
is he in remission still?
So we're more than 3 years out with no evidence of any malignancy, and his and his kidney is functioning as it was the day we treated him.
Wow, what a totally different story. 2 totally different stories.
It's amazing. The level of technology is so different, and the options are fantastic.
Yeah, I think the takeaway is do your homework. Do your homework. Thank you so much, gentlemen, for being with us. If you have any questions for Phoenix Cyberknife and Radiation Oncology Center, you can email them at info@pcroc.com. They are located at 4611 East Shea Boulevard, that is in Phoenix. Give them a call, 602-497-0605, and you can visit them online at phoenixcyberknifecenter.com.